Finally, the second coronavirus wave seems to be ebbing, and India appears to be on the path of recovery. For the first time in 40 days, less than 2 lakh COVID cases have been reported. Daily deaths are also witnessing a slight dip. But the big challenge now is what next? With a majority of the country under various stages of lockdown, it's unlocking India that now holds the key.
The savagery of India's second wave is far from over. The country is still struggling to cope. But there are 4 new indicators of hope that things are getting significantly better. First off, India's daily official caseload has dropped to below 2 lakh for the first time in 40 days. India posted 1.96 lakh cases in the latest 24-hour period.
पिछले 22 दिनों से कंटिन्यूअस डिक्रीज इन एक्टिव केसेस देश में नोट किया जा रहा है। जो हमारे केसेस हैं वो एक्टिव केसेस से अगर हम कंपेयर करें तो पाते हैं कि पिछले 11 दिनों में यह कंटिन्यूअस बेसिस पर रिकवरी इज मोर देन द केसेस व्हिच आर गेटिंग रिपोर्टेड।
Second, the numbers saw a big drop despite testing nearing a record high of 20.5 lakh daily tests. What this means is that India has not slackened off on testing, with fewer tests resulting in confirmed cases.
पिछले 15 हफ्तों में करीब 2.6 टाइम्स देश में जो टेस्ट होते थे उनकी संख्या में बढ़ोतरी की गई है। हमने देश में अब तक के हाईएस्ट टेस्ट किए, यानी कि 21,23,000 के करीब टेस्ट देश में एक दिन में किए गए।
Third, there has been a big drop in the number of reported deaths too, to just over 3,500 deaths nationally in a 24-hour period, with a significant slide in deaths in Haryana, UP, Gujarat, Andhra Pradesh and other big states. Fourth, active cases have taken a nosedive to the 26 lakh mark, a steep drop from a high of 37 lakh. The indicators are allowing India, splashed in red, to slowly brighten up, with hotspot districts posting substantial recoveries and fewer cases. The reappearance of a few green and many yellow patches in India's district-wise map showing daily new cases is an indication that the worst may be over. India's recovery comes at a time when over 90% of the country is in different stages of lockdown. It is clear that lockdown works, but for now, it's the unlocking that holds the key. Bureau Report, India Today.
The good news is caseload is coming down, things are looking better. The bad news is what happens next depends on all of us together. If we demonstrate COVID-appropriate behavior, the situation will continue to get better. If we go back, start living it up, start partying again, meeting people again in big numbers, the situation can deteriorate very quickly. So how do you draw the balance now between life and livelihood? Joining me on this broadcast, I want to welcome my top quality panel. Professor Brahma Mukherjee is at the Epidemiology Department and the Chair of Biostatistics at the School of Public Health, University of Michigan. She's been running a tracker which is being widely followed in India and abroad. We have on this broadcast Professor Maninder Agarwal. He's a professor at IIT Kanpur, member of the National COVID-19 Supermodel Committee. Professor Gautam Menon is at Ashoka University. We have Dr. Giridhar Babu. He's a professor and head of the Epidemiology Department at the Public Health Foundation of India. So welcome to all my guests. I want to go across first and foremost to the Corona India dashboard as I take you through the picture as it exists at this moment. We got our data team to update the COVID India heat map. Now look at this carefully and I'll play it twice so that you can see. This is the situation on the 8th of April when things were very green, not so bad, started deteriorating very quickly as the month of April went on. In May, the situation was so bad that more than 500 districts were reporting 100 plus cases. That's now down to 327. Let's just see it again so that you can process this information more closely. This represents each of the districts of India, and the color shows how many COVID cases are being reported there. On the 9th of May, 501 districts had 100 plus cases. That's now coming down. The number of districts at this moment with between 10 to 100 cases is 311, less than 10 districts is 89. So net, the picture is indeed getting better. Even if you look at all the key states, apart from Tamil Nadu, which at this moment is represented by this light blue line, where the caseload is continuing to go up. In Maharashtra, which is represented by this red line, the trend line demonstrates a definite dip from 60,000 plus cases to less than 23,000 cases now. In Kerala, which is represented by this yellow line, so this yellow line here, the number of cases again in Kerala coming down. In Karnataka as well, now down to 25,000 cases. It went up to a peak in mid-May, coming down. Same is the case with West Bengal, which is represented in this neon green light. So, with that said at the outset, let's now try and understand from our guests two things. One, what's the current situation at this moment? What's their reading of the situation? Secondly, by when can we start talking about lifting restrictions? Let me put that question first to Professor Brahma Mukherjee in Michigan. Give us your reading based on your analysis of your statistical models about the pan-India situation at this moment, your reading of where you think things are getting better, what are the areas you are most concerned about, and net, how you see the COVID wave in India at this moment.
Thanks, Rahul, for that question, and thanks to be convening a wonderful panel with co-authors and friends. So I think we'll have a lot of similar things to say, because everybody on this call, I think, predicted that the peak is going to happen sometime between, the national peak is going to happen sometime between the first 2 weeks of May. And we have seen that. But at the same time, I think I'd also like to use some words of caution, because as you showed, that the national peak is driven by large metros and a few states. And so all states cannot get into this mode that the peak is over. And also we know little information about rural India, but I think it's comforting to see that the total case counts are dropping. And this is consistent with the predictions made by models way back in April. So that gives you some reassurance about the ability of these models and forecasting models as well. So I do think that we have to really watch out. Some of the northeastern states are showing a little uptick, and I am very glad to see that taking these signs, they are actually intensifying their public health intervention measures. So I think that lockdowns work, and the key thing in the next few weeks is, as you pointed out, how we emerge out of the lockdowns and how we unlock these major states.
So we'll build on that. I'll come back to you. We'll talk about your ideas of how to unlock. I just want at the outset a broad sense, Professor Gautam Menon, about your reading of the COVID situation in India, because part of the reason why things are looking as good as they are, or much better than they were, is because we aren't fully accounting for the COVID caseload in rural India, which is where cases are spreading maximum at this moment. So if you were to account for that, then what's your reading of where India is in its battle against COVID? Is the peak of the second wave truly now behind us? Can that be said with some amount of certainty?
I think now we can increasingly be more certain about it. The trend has gone on now for about 10 days to 2 weeks. And so that's sustained. Earlier, it was a little harder to say. Even as before, whether the extent of reporting that we're seeing from states, big states like UP and Bihar, actually reflects the situation is not completely clear. But on the other hand, I think both in rural and urban districts, by and large, you're seeing a downtrend. The increase in cases is coming from the south of India. You still have high test positivities in all of the 4 southern states. The northeast is another place to worry about. But on the other hand, Delhi certainly seems to have turned a corner with less than 5% test positivity. So let's pay attention to test positivity now. I think things are improving. Let's see what happens over the next week to 10 days.
Professor Maninder Agarwal, your projections based on the model that you're looking at closely about what may happen from here. Your assessment of where we are at. Gautam Menon spoke about what may happen from on the next 7-10 days. What's your model telling you? You're mute, so just unmute yourself, Professor Agarwal.
Sorry.
Go on.
Yeah, I was saying that we have clearly peaked. And what our model predicts is that while the actual number of cases don't get reported, but the reported cases actually are just showing us a scaled down version of the reality. So when the reported cases peak, that's broadly when the actual cases also peak. So we can safely say that we are past the peak. And this is also corroborated by ground reports. Particularly in UP, I regularly talk to reporters who have an idea about the rural situation. And they are all saying that the number of cases in rural UP is also going down dramatically. So yeah, I think we can say that we have passed the peak, but that doesn't mean to declare victory now.
Oh, sure. Giridhar Babu, I saw in that data, and I'll show our viewers once again, that it's Tamil Nadu, which at this moment is the one big state which isn't showing a trend line that is on a decline. In fact, in Tamil Nadu, if I call up the state trajectories, you can actually see the blue line still continuing to go up. So can you take us through the states where you think we still need to be concerned, states where we haven't reached the peak yet, and where do you think we can confidently say that the situation is getting much better?
Yeah, thanks Rahul for having me on the show, and it's great to be with the brightest minds in the world. So let me explain my own take on understanding whether we have passed the peak. The answer lies in where the peak is. So if we are referring to the peak only in the metros, in the urban areas, yes, probably we might have already crossed the peak, at least in the major metros. But in the rural areas, according to me, we are peaking right now. And it might be a wrong thing to say that as a country we have gone beyond the peak, while just to give you some statistics, nearly 70 districts in the bigger states have more than 100% increase in monthly growth rate of the deaths. Same thing is happening in terms of cases. More than 70 districts in the bigger states have 100% case surge in the last 1 month. But Rahul, the problem here is these are probably the districts which are testing well in rural areas, and that's why they are reporting cases. There is gross underreporting of cases in rural areas because simply we do not have the kind of testing facilities in rural areas as we have in the urban areas. So right now I feel we should be redistributing our resources, both in terms of testing, early treatment and early isolation in rural areas, rather than getting into a phase where, yes, we need to do unlocking only in those areas which have probably crossed the peak, but in the areas where the surge is happening now, we need to have a graded approach in terms of how to address the rural areas differently, and how to address those states which are peaking now, as you clearly stated, Tamil Nadu, in a different way.
Okay.
If you see the kind of lockdown that we had, although we are not saying it, it is nearly nationwide lockdown in terms of every state going into that. So now the same strategy may not be the way forward. We need to be looking at urban, rural, and the states which had earlier surge compared to the states which are having surge now.
So let me now come to the second part of this conversation, and that is to do with the best way to unlock. Professor Mukherjee, to you first. You're looking at what happened in the United States where you are, you've seen what happened in Europe, and you understand the Indian psyche. My biggest concern is if you unlock too soon, people think khatam ho gaya, it's all okay, we can go back, and then you're having marriages, meeting people, and then we can have the caseloads rise again. So what is, in the Indian context, according to you, the most sensible way of unlocking, Brahman?
Thank you, Rahul, for that question. First of all, I'd like to just reiterate that we have gotten very used to very high numbers, but we are still registering twice the number of cases than the wave 1 peak, and 3 times more the number of deaths than wave 1 peak. So we should not forget about that. Relative calibration is always good, but we should look at the absolute numbers of people who are sick and who are experiencing pain and grief. So in terms of unlocking, I agree with Giri that it is probably going to be much more in a staggered manner, that some states which are controlling for example, Delhi, if the case counts come below a level that we feel comfortable with containment, we are gradually going to release. But I think that what I saw in the US is the knowledge that we have gathered in the last 1.5 years about the transmission of this virus put to use as we designed our exit strategies. So the exit strategies were quite humane, nuanced, strategic, optimized, because we know indoor gatherings where you have to take off masks, that's the highest risk places. So there has been several papers in JAMA and Nature really ranking activities in terms of the additional risk it confers. So as we are making these decisions, I'd really encourage people to make use of the science at a personal, at a community level, and really decide on nuanced strategies. And also, as we go out, we cannot make the same mistake again that, as you said, it's over, relax. Hopefully, we have learned from this really massive mistake that as we meet more people, we need to intensify. We really need to wear our mask. We really need to avoid large gatherings, particularly indoor gatherings, and use our personal prevention strategy. Another thing I think which is very careful planning in terms of US I have seen is that even post-vaccination, as we are going out for outdoor dining, for example, we are always being contact traced, so that if there is an outbreak, all of us who went to that restaurant are informed very quickly so that we can arrest that cluster outbreak. So I see a lot of potential of doing a job which is not like a hammer, but much more nuanced so that people can get back to life and the economy can revive.
Gautam Menon, your sense of whether we can start relaxing restrictions from as early as next Monday? The Delhi Chief Minister, for example, said that the current lockdown is till Sunday and that there will be some easing of restrictions from next week onwards. What are the kind of restrictions that you would be comfortable doing away with starting in just a few days from now? Let's assume Monday.
Okay, so let me take off from where my friend and colleague Bhramar took off. Let's just normalize mask wearing as one very important thing that we can do. We've now been used to, over the past several months, to wearing masks. Let that become a common part of our lives. Let's introduce testing and make testing more accessible, including increasing the number of rapid antigen tests. Just make it possible for people to have testing on demand. Again, that's going to help you curb the numbers of cases. Vaccinations, prioritize the elderly, and raise the number of vaccinations to 10 to 12 million per day. That's another long-term solution that we just simply have to get into. But one thing that I want to mention specifically is ventilation. We haven't taken that seriously enough. The PSA, the Principal Scientific Advisor, had mentioned this in his last communique, that we have to pay much more attention to ventilation in public spaces than we have so far. That is very, very important, and I hope the Delhi government considers this. The other points are make data more accessible and available so that we know what's going on. The modelers can trust that data to make predictions and projections as to how government should behave, how should to integrate this information together. And finally, address hesitancy, which is very important. There's some hesitancy around testing, there's hesitancy around vaccines. We have to figure out the best way to communicate this all together and to think about what behavior we want to curb. One last point is that let's get away from sort of theater of restrictions and lockdowns. Instead of allowing shopping only for 3 hours a day or 4 hours a day, and thereby ensuring that everyone congregates together in that period, expand that time, but have fewer people in shops at any given time. That's very important, and I can't stress this enough, this particular point.
Professor Giridhar Babu, when the UK and the United States started easing restrictions, by then they'd really been able to vaccinate a far bigger percentage of their population. In India, and I can go across once again to show you the latest vaccination data. In India, the number of people being vaccinated as a percentage of our overall population is still very minuscule, and the graph continues. If you see, this is the yellow line represents the total number of people vaccinated. It's 19 crores at this moment, but it's still a graph which is, you know, a downward facing graph. It's just begun to pick up over the last few days, but it's a graph that's generally coming down. And in the same way, if you look at the key states where vaccination is going on, it's far slower. Huge vaccine shortages still being reported. Therefore, what's your sense? Can we afford to start easing restrictions starting next Monday, even though we haven't been able to vaccinate too many people, or would you rather hold on for a while till we're able to vaccinate more people and drag the lockdown till then? Giridhar Babu.
Yeah, so Rahul, I'll give my own a realistic assessment. Let's look at the vaccine supplies. I don't think it's going to change till the end of July. So the vaccination pace can only increase from the beginning of August onwards. In my own sense, we have to cover at least 10 million doses per day to be at least confident of covering 300 million in a span of ahead of the next wave. So that's the step number one. Step number two, how extensive is the lockdown now? We should be making decisions in terms of local evidence-based unlocking. And right now, it is a neighbor did the unlocking, so I'll do. And because I did, the next neighbor will also do unlocking. That won't work in a system like this. We need to be looking at the data very clearly, as Gautam pointed out. We need to be developing dashboards with scenarios from the real-time data to guide this process. And this decision has to be at the district and state level. The third most important thing, Rahul, is the whole purpose of lockdown is to just reduce the speed of transmission. If we are failing to detect the number of cases during the lockdown and contain them, we are actually allowing some kind of masked transmission going on. We don't know what is the impact the moment we unlock. So unless we increase testing levels in rural areas and in the areas where testing is not good, unless we ensure that the transmission is actually interrupted in all the areas, we can't be sure that after unlocking things will be
no, one second. Can I ask you a direct question, Dr. Giridhar Babu? Are you suggesting that Monday would be too early to start lifting restrictions, that the current state of an extreme lockdown with very harsh restrictions should continue beyond next Monday, even when caseloads are coming down?
So let me answer this like this, Rahul. I don't think we should be taking a decision nationwide. This decision should be taken for each state based on the data there in terms of what is the overall test positivity, what kind of test are we doing.
So let me build on that question then. Which are the states where you'd feel comfortable lifting restrictions starting next Monday, and what are the kind of restrictions that you'd be comfortable easing?
Of all the states, I'm very comfortable about looking at the data from Tripura and Odisha. Odisha is a perfect example for consistently increasing the test per million. Their cases have been detected well. The death per million is going down. And the most important thing, there is correlation between higher vaccination coverage and lower death per million, which is what you just said before.
But what about Maharashtra, Delhi, Uttar Pradesh, some of the other states which have been locked down very severely, where also the caseload and the caseloads are coming down, the trend line is heading south?
I should also let Brahma, Gautam and Professor Maninder answer these questions because they're monitoring more states. But my own sense is that the testing is not uniform. The testing is mostly done in the capital cities and only in the urban areas.
Okay, so you voiced your reservations. I hear what you're saying. Let Maninder Agarwal come in. Professor, which are the states where you would feel comfortable easing restrictions starting next Monday, and where do you think restrictions should continue and why?
I think as the other panelists pointed out, it should be a state-wise decision, and I believe several states can seriously look at easing restrictions from the Monday.
Which ones? Which ones?
Which include Delhi, Uttar Pradesh, Rajasthan, Gujarat, Madhya Pradesh, Telangana. Off the top of my head, I can.
No, so when you say easing restrictions, just try and explain that to me. What do you mean by easing restrictions? What are the activities that you'd be comfortable allowing?
It's a lockdown or no lockdown, yeah. It has to be a gradual process. So that is, for example, it's a very good suggestion that was made that don't have open markets for 3 hours. Everybody will just crowd there and it will not help. Allow the markets to be open. Just allow normal movement of people, ensure that they are wearing masks, and ensure that there is no crowding anywhere, to the extent possible. These are the two very key things that need to be ensured by the governments or district authorities locally. And if they can ensure that, then I think
so what should not be allowed you are dwelling on? I'm asking you what activities can be allowed. People have been at home now since different times in April. Is it okay to start thinking about going back to work yet? What are the kind of industrial activity, manufacturing activity, corporate offices? How do you see that play itself out?
I believe that can all be started with some careful care. That is, again, in a corporate office, as was pointed out, it's an indoor environment. There should not be crowding. There should be proper ventilation. So some of these things need to be ensured, and then the life can resume.
Brahma Mukherjee, do you agree with that, Professor? The point that the IIT Kanpur professor makes, that you can now start thinking about going back to work, factories that have been shut can start opening, that this is a good time to start having some of those conversations?
So I think, no one size fits all. So it has to be really targeted towards the community that we are talking about, towards at a very granular, at a district level. But I think that safely reopening workplaces and schools and other places of gathering, there are lots and lots of literature now how to do that and what are the high touch points. And again, you may not have full occupancy. You may, when University of Michigan first opened, it was really the essential functioning at a 10% occupancy, 20% occupancy. You have to gradually nibble at it and again make progress in a very slow way, because I would always err on the side of caution.
You mentioned schools. When you say schools, do you think it's possible that our children will be able to go back to school this year, or is this academic year also completely written off in your view?
So I think it really depends on vaccination. So that's the one thing that pressing.
No, kids aren't vaccinated. So kids aren't vaccinated. They're vulnerable in that sense.
Not for kids. I think country-wise vaccination is a key. And again, in Michigan, when schools first opened, it was randomly like 20% of the students were coming in on Tuesdays and Thursdays, and some people were coming in on Monday and Wednesday. Nothing opened like, full 7 days for everybody. So I think we really have to think about that. And also in the summer, I see classes are happening outside, outdoors, in yards and backyards. And so you make use of the open spaces. And I think that to give people a sense of normalcy very gradually would be the way to go, because we also need the social sustenance and a sense of normalcy, and just not sitting at home for 2 years for kids, I think it's affecting their learning and mental health outcomes.
With respect, Professor, I didn't get a clear answer, so I'll press you further. Do you think that it will be possible for children between grades 1st and 12 to go back to school this year? They're not vaccinated. There's no plan to get them vaccinated anytime soon. Lots of children and parents would like to know your view on whether there will be an academic year which involves learning inside a classroom physically, or will it all still be on Zoom and Google Meet?
So, Rahul, the stochastic crystal ball has finite radius. You're trying to make epidemiology and human behavior an exact science, which it is not. So I will resist giving you a definitive answer because there is tremendous uncertainty around it. But it really depends on how hard we work at a micro level planning. So it is true that 40% of India's population is from 0 to 18, where there is no a solid vaccination plan there. So we really have to think about vaccine trials in that group as well as vaccination. But I am hopeful that gradual really releasing, not having everybody at the same time, but giving people a sense of in-person instruction is going to be possible. That's what I hope, but it really depends on the public. It really depends on policymakers, and I cannot give you a clear answer.
Gautam Menon, let me try with you. Brahma Mukherjee refused to play Nostradamus. I wasn't actually asking her to. All I was doing was getting her to give her best sense at this moment, which is way better than our best sense about whether kids will go back to school. Is it at all possible? There's a big debate, as you know, in India at this moment about whether class 12 examinations should happen. Do you think it's safe for those exams to take place from an epidemiological perspective, or do you think we should just call them off? Gautam Menon.
I mean, I appreciate and understand Brahma's caution. And my personal view is that beyond about August, if you can vaccinate everyone in the 45 plus age group, plus the persons directly in contact with the children, the teachers and other people in the school, then I would be much more comfortable with sending children back to school. I think because it's certainly true that even though children may be infected the chances of adverse outcomes in children is much, much, much smaller than in adults and people with pre-existing conditions. So I think there certainly is a horizon there if you can get your vaccination straight.
No, but it's not that complicated. You know the vaccination pipeline. You know how many people have been vaccinated. You know at the current rate of production and dissemination of the vaccines, how many people are likely to be vaccinated in which age category by August. Given what you know at this moment, do you think it will be safe for schools to reopen in September? Gautam Menon.
Actually, the vaccination situation is not that clear. As, it's true, what Giri said is true, that it's hard to imagine that before August we'd get to anywhere near 300 million, which would be a sort of good number to base some motion on. But it certainly seems true that now there aren't enough vaccines to go along and people not reach a target of 300 million to 400 million. But things can change between now and then. I'd be positive about that. If not in the next month, maybe in the months after that. And we might have to shift the August to September. But I see a horizon there at least.
Giridhar Babu, would you feel comfortable as well, considering allowing schools to reopen come September, that even if it's just half the year, at least our children could have possibly half an academic year on campus?
Rahul, this question is loaded, and it's akin to blindfolded persons trying to palpate an animal which we don't even know. The reason is we don't know the seroprevalence in children. We don't know which vaccines are effective in children. We don't know what proportion of their parents.
All of you are acting at this moment like poll pundits or exit pollsters who are being asked to call West Bengal before the counting day figures actually come out, and you're being guarded, and I appreciate that. But the way I ask this question honestly is that you have a better sense on the basis of all the data that's before you than a random, because each person has an opinion about whether there will be school, for example, or whether the CBSE exam should happen. Yours is a more informed opinion. Therefore, I'm seeking your indulgence and trying to extract that from you. Giridhar Babu.
Yeah, so I think I'll stick to what I was saying earlier. We might be in a position to probably have an academic session viable next year, provided there is improved vaccination coverage. And that should happen not as the way it is happening now. This is the story which India can actually turn around. Invite all the manufacturers to come to India, have joint ventures with the Indian companies and manufacture at scale, which will not only cater to the Indian needs, but also be the real supplier for all the low and middle income countries. This is the opportunity. We need to pursue this at a very strong and urgent pace. That's the only way we can turn around this story. If unprecedented efforts have to be taken by collaborating with all the private partners, this is the time, Rahul. That's when not just schools and colleges, we can get back to as normal life as possible. Like I'm so jealous of Brahmer and everyone else in US where they don't have to wear masks. At least if they're vaccinated.
Well, I am using my masks. So though the recommendations are that you don't need to, many of us are. So
Brahmer's only in the US physically. Her heart is still in India. She has lots of families and friends here who she's still very worried about. So she's not fully over the COVID wave just yet, keeping a track very closely of what's happening in India. For the time being, Professor Giridhar Babu, Gautam Menon, Maninder Agarwal, and Brahma Mukherjee, for joining me with your very sharp insights, for being guarded, for urging others to keep their masks on and their guard up. Thank you very much. I appreciate the kind of insights you were able to give us on this high quality conversation.